Hello and welcome to the COFA Islander Healthcare training presentation. For this presentation, we will cover the following topics: background, program eligibility, COFA Islander Healthcare application, funding, outreach, operational impacts, implementation and timeline, and glossary and resources. Background. The Compact of Free Association, or COFA, is an economic and military treaty between the United States and Republic of Marshall Islands, the Republic of Palau, and the Federated State of Micronesia. The Federated States include Yap, Chuuk, Pohnpei, and Koshrea. Individuals from these nations can come and go freely from the United States. These individuals have a non-qualified immigration status that limits their ability to get federally funded Washington Apple Health or Medicaid. The exception to this are pregnant individuals and children aged 19 and younger. Substitute Senate Bill 5683 was passed by the legislature this session to give COFA Islanders who are also Washington residents health care under a qualified health plan. The bill funded COFA Islander healthcare, which enables HCA to pay the premiums and out-of-pocket costs for individuals who have household income under 133% of the federal poverty level, or FPL, and are also enrolled in a silver-level qualified health plan. These individuals currently are not eligible for Apple Health programs. This slide displays where the COFA nations are in the world. The U.S. conducted 67 nuclear tests in the Marshall Islands between 1946 and 1958. High levels of radioactive fallout contaminated the region, which continues to produce measurable radiation levels above naturally occurring background levels, according to the Columbia University study. Marshallese people suffer from high rates of cancer and diabetes. According to the 2009 through 2011 American Community Survey, 24% of Marshallese in the United States were uninsured. Washington State has the second largest population of Kosraeans and the third largest population of Palauans and Marshallese people in the United States, according to the 2010 U.S. Census. COFA migrants reside in Woburn, Everett, Federal Way, Spokane, and Vancouver. The six main languages are Chuukese, Marshallese, Pohnpeian, Yapese, Palauan, and Kosraean. Currently, individuals can select Chuukese and Marshallese in Washington Health Plan Finder. Chuukese is the outdated name for Chuukese. This map shows the locations and how many COFA Islanders applications are in Health Plan Finder. Program eligibility. To qualify for COFA Islander healthcare, an individual must be a COFA Islander and a Washington resident, have countable income under 133% of FPL, not be eligible for other minimum essential coverage such as employer-sponsored insurance, Apple Health, or Medicare. File federal taxes even if they do not meet the tax filing requirements. Qualify and take the Maximum Advanced Premium Tax Credit, or APTC. And finally, enroll in a silver-level qualified health plan, or QHP. The effective date of COFA Islander healthcare follows QHP rules, which are different from Apple Health. In general, QHP effective dates follow a cutoff of 15th of the month for changes to be effective the next month. This means changes made between the 1st and the 15th will take effect the next month, and changes made after the 15th will take effect in the month after next. Let's look at a couple of scenarios for better understanding. Scenario 1. Before the 15th of the month. Mary has been enrolled in COFA Islander healthcare since January 1. On June 7th, she reports her income is 145% of FPL and she's now over income for the program. COFA Islander Healthcare will end June 30th since she reported this change before the 15th of the month. However, she remains eligible for QHP. Scenario 2. After the 15th of the month. Steve has been enrolled in COFA Islander Healthcare since January 1. On June 17th, he reports his income is 172 FPL and he's now over income for the program. COFA Islander Healthcare will end July 31st since he reported this change after the 15th of the month. However, he remains eligible for QHP. Scenario 3. Before the 15th of the month. James applied during open enrollment for COFA Islander Healthcare, but due to his income of 182% of FPL, he is not eligible for the program, but he enrolled in a silver level qualified health plan. On June 10th, he reports his income is now 121% of FPL and he is now eligible for the program. COFA Islander Healthcare will begin July 1st since he reported this change before the 15th of the month. Applications. A Washington Helpline Finder account is required for individuals applying for COFA Islander Healthcare. Washington Helpline Finder accounts are required for all individuals enrolling in QHP on exchange, but are optional for those applying for Apple Health. This may mean individuals with existing applications must create an account if they would like to apply for COFA Islander Healthcare. An individual can submit application for coverage during open enrollment via online at www.wahealthplanfinder.org, downloading a mobile application, WA Plan Finder, by calling 1-855-923-4633, or they can also submit a paper application. An individual may qualify for a special enrollment period for certain life changes. Find a list online by visiting the link provided in this slide. For the benefit year 2019, open enrollment is November 1st through December 15th. COFA Islander Healthcare begins January 1st, 2019. Open enrollment period could change every year. Make sure to check with the exchange each year for the correct dates. The application does not include a place to attest to being a COFA Islander. Individuals will enter their I-94 card information and/or their foreign passport information into the application. To enroll in COFA Islander Healthcare, individuals must enroll in a silver level qualified health plan. Those who are unable to select a qualified health plan for a client should contact their lead organization for assistance. This screenshot shows that a plan selection has been confirmed. To enroll in COFA Islander Healthcare during the benefit year, an individual must qualify for a Special Enrollment Period or SEP. Qualifying events include changes in household size, reconciliation of federal taxes, loss of minimum essential coverage. For a complete list, please visit the link on this slide. Individuals enrolled in COFA Islander Healthcare will be sponsored by HCA in Washington Helpline Finder and will receive a letter confirming this after they apply. Without system support to this first open enrollment, this letter will come a couple days after the application has been submitted. As a sponsor, HCA will pay individuals monthly insurance premiums directly to the carriers. If an individual enrolled in COFA Islander Healthcare receives a bill from the insurance company in the first month, they should not pay this bill since they are sponsored by HCA. Be aware that you may not immediately see HCA as a sponsor upon enrollment in a server level QHP. This may take a few days to update. Individuals will receive a letter when approved for COFA Islander healthcare. Confirmation of sponsorship can be found on the My Profile tab in Washington Helpline Finder. Federal regulations require all state-based exchanges and the federal marketplace to verify eligibility for individuals. Conditional eligibility is a status a QHP or qualified dental plan individuals may receive if they have submitted an application and the federal hub was unable to verify information entered in their application. There is a 95-day time frame to provide documents and resolve inconsistencies. Individuals may receive tax credits and cost-sharing reductions during this time. An individual can be in the conditional eligibility verification for the following: Social Security number, citizenship or lawful presence, if indicated as a lawful present immigrant or non-immigrant, incarceration, eligibility or enrollment in non-employer-sponsored insurance, such as Medicare, TRICARE, Veterans Health, and Peace Corps, income or tribal membership. Individuals whose lawful presence is not federally verified will be approved for Apple Health for a reasonable opportunity period. Verification for TRICARE, Veterans Health, Peace Corps, and income is required for advanced premium tax credit eligibility. This yellow banner will appear across every tab when an individual or someone in a household has a conditional eligibility status. Funding. State and federal laws allow organizations and government agencies to pay monthly premiums on behalf of individuals who are enrolled in a QHP through Washington Helpline Finder. The Healthcare Authority is listed as a sponsor for individuals enrolled in COFA Islander Healthcare, which means that the agency will pay for the QHP premiums directly to the insurance carrier. Out-of-pocket costs are expenses for medical care that are not reimbursed by the insurance. This includes co-payments, co-insurance, and deductibles, cost-share requirements imposed under qualified helpline for services, pharmaceuticals, devices, and other health benefits covered by the plan and rendered as in-network. Out-of-pocket costs excludes premiums, balance billing amounts for out-of-network providers, and spending for non-covered services. The funds provided by the agency for out-of-pocket costs are called cost-sharing funds. These funds cover out-of-pocket costs for services rendered as in-network. Cost-sharing funds cannot be used for services that are not covered by the plan. Even when in-network, it is always the client's responsibility to check what services are covered with their plan. Qualified Dental Plan, or QDP, is not included in COFA Healthcare. Individuals who select a dental plan are responsible for their own QDP premium. A cost-sharing funds card will be mailed to each individual enrolled in COFA Islander Healthcare. The funds on this card are for out-of-pocket costs only. This means co-pays, co-insurance, deductibles, prescriptions, and other costs for in-network services. The card cannot be used for services that are not covered by a QHP and rendered as out-of-network or are balanced billing amounts. For example, if a plan only authorizes 15 physical therapy visits during the year, the card cannot be used to pay for any additional visits. The card may be received within 2 weeks after the approval on a program. Each card will have a $300 monthly limit. At the beginning of the next month, the card will be refilled up to that limit. For example, if the balance on the card at the end of the month was $200, $100 will be added to bring the cost-sharing funds back to the $300 monthly limit. If additional funds are needed, for example, to cover prescriptions or pay a bill, HCA must be contacted for authorization of additional funds. It may take 48 hours to load more funds after an authorization has been approved. If more funds are needed and the individual calls on Friday, the funds will not be available till Tuesday. Outreach. HCA anticipates that there is about 1,200 to 2,500 individuals eligible for the program in Washington. Analysis shows the most populous counties include Spokane, King, Thurston, Clark, Snohomish, Pierce, and Covlitz. HCA is hosting a COFA advisory committee made up of community members, carriers, advocates, lead organizations, navigators, and state partners. This group is helping advise HCA on making decisions about the implementation of the program. HCA launched a culturally and linguistically accessible outreach campaign. This includes outreach materials, videos, social media campaign, and website. You can check out the website now at www.hca.wa.gov/COFA. HCA hired 6 part-time and temporary community workers to help individuals apply during open enrollment. Many of the community workers are members of the COFA Islands, so they can locally connect and assist members of their community with the enrollment process. Community workers available to help in other communities where smaller populations reside. These outreach materials and more can be found in a toolkit on the COFA Islander Healthcare website. Please see the link on a resources slide for the most up-to-date materials. Operational impacts. Many COFA Islanders enrolled in the program may have households that include children receiving Apple Health coverage. Households may have a post-eligibility review, children aging out of Apple Health and transitioning to COFA Islander Healthcare, pregnant women transitioning to COFA Islander Healthcare after pregnancy coverage ends, and individuals who are transitioning from a reasonable opportunity period if they had an unverified immigration status. Individuals cannot receive COFA Islander Healthcare and other minimum essential coverage or other federal or state medical assistance programs. This may include DSHS programs. This does not include Alien Emergency Medical or AEM, as like today, individuals can remain eligible for both AEM and a qualified health plan, as AEM only covers emergency. Family planning is another program where individuals can be enrolled concurrently with COFA Islander Healthcare, since family planning is not considered MES or minimum essential coverage. Medical care services will also take precedence over COFA Islander Healthcare coverage. However, individuals will not be pre-screened during the application process. Some COFA Islanders qualify for Medicare if they have enough work credits. If they qualify for Medicare, they will not qualify for tax credits or for COFA Islander Healthcare. What is a reasonable opportunity period, or ROP? It is a 90-day time frame given to an individual to verify citizenship and lawful presence when federal and state electronic systems are unable to verify the information. Individuals applying for COFA Islander Healthcare could be approved for Washington Apple Health due to the reasonable opportunity period. The Healthcare Authority will review these cases. Individuals receiving COFA Islander Healthcare and who become pregnant have the option to continue with COFA Islander Healthcare or Washington Apple Health Pregnancy Medical. If individual reports the pregnancy in Washington Helpline Finder but decides to continue in COFA Islander Healthcare instead of Washington Apple Health, the due date will have to be removed from the application. Scenario 1. Bob has been enrolled in COFA Islander Healthcare since January 1st. His children are enrolled in Apple Health for Kids with a review end date of March 2019. Bob must manually renew his children's coverage. He updates his application to the Washington Helpline Finder and reports an income of 210% of FPL. His children remain on Apple Health for Kids. Bob is still eligible for QHP but no longer qualifies for COFA Islander Healthcare due to his income. Note that this time Bob does not qualify for COFA Islander Healthcare. However, he's still eligible for QHP with tax credits and cost sharing reductions. Scenario 2. Jane has been enrolled in COFA Islander Healthcare and her children are enrolled in Apple Health for Kids. A post-eligibility review was completed on September 17th. An income of 153% of FPL was verified using wage stubs. The application was updated, and as a result of the post-eligibility review, Jane remains eligible for QHP, but no longer qualifies for COFA Islander Healthcare. Note that at this time, Jane doesn't qualify for COFA Islander Healthcare. However, she is still eligible for QHP with tax credits and cost-sharing reductions. Implementation and timeline. The following are some of the first-year processes: manual processing and enrollment. Daily reports will be shared between Health Benefit Exchange and HCA. Sponsorship program will give HCA the ability to pay for premiums. The HCA will be paying for out-of-pocket costs using cost-sharing funds. And the letters will be sent through Washington Helpline Finder using mass correspondence. The second-year outlook will be slightly different. We will have system support in Washington Helpline Finder. The planned shopping experience will be tailored to COFA Islander Healthcare. For example, the plans will clearly be marked as COFA eligible plans, and the amount for premium will show 0 since the HCA will be paying for their premium. This timeline shows some milestones of the implementation of the COFA Islander Healthcare. Glossary. In this glossary, you can find some of the terms and concepts of this presentation. This includes advanced premium tax credit, benefit year, COFA Islander, and co-insurance. Please take a moment to review this slide. In this slide, you will find the definitions of co-payments, cost-sharing funds, cost-sharing reductions, and deductibles. Please take a moment to review this slide. And in the last slide of the glossary defines household, out-of-pocket costs, preventative services, and tax credits. Please take a moment to review this slide. Resources. For more resources of the COFA Islander Healthcare, please visit the COFA Islander website at www.hca.wa.gov/COFA. For questions, please email us at cofaquestions@hca.wa.gov or give us a call at 1-800-547-3109. Thank you.